Good morning, everyone, and welcome to the 2022 Family Strengthening Network Summit. My name is Sharlene. I'm the director of LA Best Babies Network, and I will be your MC for today. Our theme this year is Standing Strong with Families in LA County. In an ever-changing world that doesn't always seem very hopeful, our families continue to count on each and every one of you. To do what nobody else does, a way that nobody else can do it, in spite of all we go through, this is to be you, the Family Strengthening Network. I can't imagine being anywhere else today. This is our 7th summit since 2015 and our 3rd virtual one. While I wish we were in a big fancy hall, every time this day comes around, I feel a little bit brighter in your presence. You continue to inspire and surprise me with everything this network can accomplish together. I'm reminded of our keynote from last year, Dr. Junlei Lee, and his message about being more than one thing, finding more than one way, the ripple effect of this work and how immeasurable your impact is. There is no way we can actually quantify or put a price tag on the long-lasting impact of your work, the positive influence of the here and now, and the generational changes that you are making. Your kindness can transform someone's dark moment with a blaze of light. You'll never know how much your caring actually matters, making a difference for another day. We won't always know whose lives we touched and made better for us having cared, because our actions sometimes have unforeseen ramifications. What's important is that we do care and we do act. I was recently asked what I do for a living, and after rambling on, the person stopped me and said, "How do you get such a large group of people from different organizations to do so much?" I blurted out without much thinking, "The only way to do great work is to love you." I am convinced that at the core of this network, what drives us to great lengths and success is because we care so deeply about families, we believe in social justice, we advocate, and because we are resilient. Our togetherness allows us to be that much stronger for ourselves, our families, and our communities. We care about others, running the risk of having big feelings ourselves and leaving an impact on people, but in turn, this brings happiness. Martin Luther King Jr. once said, "Life's most urgent question is, what are you doing for others?" Regardless of the role you play within this network, that concept is our commonality. We still live in a time when we need more voices like yours advocating for people to work together to solve challenges, because we know that many of our families still don't have that voice. We need more voices that talk about treating one another with dignity and respect. We need more people who remind everyone that the best way to overcome our differences is to come together in the service of others. I remind you every year, and I will do so again today. You may not realize it right now, but you are involved in the largest home visiting initiative in the country. Home visiting has impacts in so many disciplines: public health, mental health, maternal and child health, family health, criminal justice, education, and so much more. The way we show up every day matters. I couldn't be more humbled than being in front of a group of people that puts children and the well-being of families first, who never stop believing that we can make a difference, that never lets challenges deter you, who never stopped for you from getting up in the morning, never stopped you from fighting, never gave up on giving an exception, engaging another child, another family, the same family, every family. Your work is groundbreaking. Ultimately, you provide a service to families and to others that is much more than just giving information, resources, connections, and answering questions. What you're doing is empowering people, families, and the communities, empowering them to be the parents they want to be, and we know they are very much capable of being, giving them the support and reflective thinking space that's necessary for them to have successes in raising their children. Today, we are celebrating the accomplishments of over the last year of the Family Strengthening Network, which consists of over 600 staff from 14 hospitals and 26 community-based organizations representing 3 models of home visiting: Welcome Baby, Healthy Families America, and Parents as Teachers. We have 4 funding sources: First 5 LA, Department of Public Health, DPSS, and CHVP. We also have guests in the audience from other home visiting programs in the county, such as Early Head Start, NFP, Mama's Neighborhood, and Healthy Start. I'm extending a warm welcome to all of you. I'd like to take a few moments to say a couple of special thank yous. First and foremost, I'd like to thank First 5 LA, a heartfelt thank you to you, your leadership, the program officers, and all support staff for continuing to back this work. Thank you to the LA County Department of Public Health and Department of Public Social Services. I'm appreciative for the implementation team and leadership for creating spaces to talk about the impacts of home visiting and how can we actually sustain this important work. members of the oversight entity, Maternal and Child Health Access, Work to Live, and PACLAC for their ongoing support, guidance, and contribution in pushing us to reach excellence in all that we do. Thank you to our Executive Director, Dr. Yana Kura, and to the leadership at California Hospital Medical Center, notably Alina Moran, our hospital president, for supporting LABBN and allowing us the creativity and space to serve LA County. And last but not least, I'd like to thank the LABBN team. I continue to be in awe of your commitment to the work, the organization, and to each other. Sometimes while I'm sitting in my office like a little creeper, I love hearing you all connect with each other, brainstorming, strategizing, and laughing throughout the day. While you each have individual talents and skills, we are a testament of what happens when you bring together such a diverse group of people. Together, we can do so much. As we celebrate all of you today, we will be spending a few hours together recognizing your accomplishments. For our keynote, we'll be hearing from Shola Richards with a presentation titled Unstoppable Resilience, the Keys to Standing Strong During Any Challenge. You'll hear from the LABBN team about the contribution of each team to the larger system and network building work. Lisa and Monica will review last fiscal year's data and identify successful outcomes, and sprinkled throughout the morning, we will have raffles and family and staff video presented as well. Before going any further, what is any session with me without a joke? So here I go. Here's my first joke of the day. All right, hopefully everyone's ready. Okay, why was the broom so late for school? I hope someone laughs. I hope my staff laughs. I can kind of hear them. Why was the broom so late for school? It overswept. Okay, I hear some laughing over there. I see a couple of smiles. All right, thank you for humoring me. All right, that was my first joke of the day. All right, some logistics before I introduce our next speakers. As a reminder, you don't have any video or voice capability today, but please make sure to use the chat box and the question answer box to interact with us and the presenters. We want to hear from you. Don't forget to use the reaction buttons as well. I'm seeing a lot of laughing. Thank you. That's like taking up my ego a little bit. I appreciate it. You can always access the summit material. They'll be dropped into the chat box, or you can use the Eventbrite page to download the objectives and the agenda for today as well. Summit gift boxes. Hopefully at this point you received your box already and have already let your succulent out of the box. And allow us to experience the summit through your eyes. Share your selfies, group photos, favorite moments during today's event on social media using hashtags such as #StrongerFamiliesLA and #HomeVisitingWorks. And please make sure to tag at LABestBabies on all your Facebook, Twitter, and Instagram posts. There's a lot to cover this morning, and while we would rather be convening in person in a fancy banquet hall, we couldn't miss another opportunity to celebrate and honor all of you. My personal hope for today is that each and every one of you leaves this space feeling valued, appreciated, inspired, and feeling like the hero that you are. Thank you for continuing to stand strong with the families you serve, standing strong with the network, and continuing to be you. Ralph Waldo Emerson said, "It is one of the most beautiful compensations of life that you cannot sincerely try to help another person without actually helping yourself." Without further ado, I'd like to invite Dr. Debbie Allen, Deputy Director at the LA County Department of Public Health, to share her opening words.
I always forget to unmute. Thank you so much, Sharlene, and both for your joke and your introduction, but also especially for so much framing your comments in terms of the love of families for their children and the support that families need for that love to really reach its full impact. I think, you know, in no week more than this last couple of weeks have we needed to be reminded that the antidote to violence is connection, and that the connections we make with families are deeply important to them, but also a sort of contribution to the well-being of our society as a whole. So I loved that you started with love, because we need to remember that's really what this is all about. I know this is, I mean, leaving aside the very big picture questions about families and their needs, I know that in a very concrete way, this has been a challenging time for home visiting programs. The pandemic, the need to shift to remote engagement, and now all the financial challenges that are hitting both home visiting programs and, of course, clients who are dealing with the changes in the economy. But I think it's also very important to recognize the opportunities that we see on the horizon, and to think about work we can do. I mean, Sharlene pointed out that we are the largest home visiting program in the country, and that's something to be proud of. But we all know that there is lots of room to strengthen and to grow home visiting in LA County. So I wanted to talk a bit about those opportunities. The first, I think, arises from Medi-Cal, from the Medicaid funding source in California, which has two strategies that are developing that recognize the need for enhanced care coordination and support for vulnerable Medi-Cal enrollees, which includes many home visiting clients. These strategies, enhanced case management under Medi-Cal's CalAIM initiative and planned Medi-Cal funding for community health workers, are both opportunities that are right in front of us to make third-party billing available for home visiting. The second opportunity arises from FFPSA, the Families First Prevention Services Act, which in LA is administered by DCFS and is, again, a potential source of payment for services to families who are at risk of child welfare involvement. We have to do work to align the current system, which relies on a patchwork of funding, with these two entitlement sources, but that work could assure a stable, sustainable future for home visiting in LA County, where we don't have to wonder each year what the sort of foundational sources of funding will be. Of course, in part, it's MCV, but MCV is, while foundational, a small amount of money when we want to have a program that really has breadth in reaching families across the county. We've pursued DrPH, working very closely with First 5 LA, has pursued two immediate opportunities I want to tell you about that should help us move towards the kind of alignment we need to engage in work with these two entitlement sources, Medi-Cal and FFPSA. The first is a grant that we've secured from the county's Performance and Innovation Fund that's going to support a year-long process to design a unified data system for home visiting across programs, across vendors, across funders. We've gotten a grant that will fund LABBN to implement this planning process over the next year in close consultation with all of you, with community home visiting programs, and certainly, working as well with DrPH, with First 5 LA, and with all of our funders. We're very excited at the idea of really having a consolidated home visiting database that allows us to talk very broadly about who we're serving, what our strengths are, what our weaknesses are, and at the same time makes it easier for programs to both submit their data and get the reports they need to funders and to the programs, the national models. The second is a grant that we've submitted. That grant we've gotten, so we're ready to move on it. The second grant is one we've submitted but has not yet been awarded to the Hilton Foundation, that would enable us, again, to design and implement, in this case, a unified billing system for home visiting programs. And this is very directly tied to this idea of being able to take advantage of third-party payment. Here again, we know you must have lots of questions about what this will mean to you and to your programs. And here again, funds are built in for LABBN to engage all of you, both in design of the planning process and in design, once the planning process is planned, then in actually engaging and designing the system. So we expect to be, reaching out to you, annoying you if necessary, with requests for your input, your opinions, your experience, your wisdom about what will make both the data system we're planning to build and the billing system we'll be starting, we hope, to work on, move forward effectively to really strengthen the system as a whole. We see these as just a couple of very important but just preliminary first steps that we will need to take to secure the future of a system that's a lifeline for so many LA families and that has the potential to serve so many more. We look forward to working very closely with you in the coming year as we do these two planning activities, year and a half for actually in both cases. and ongoing to make home visiting more effective and efficient. But really the efficiency is in service of being able to meet the needs of a larger, more inclusive range of families across the county, and securing a program that really should be foundational in the county's system of service to families and to its communities. Thanks so much, and I look forward to hearing the rest of the day.
Thank you so much, Dr. Allen, and appreciate you giving us a broad view of what's upcoming for the home visiting field and LA County. So appreciate you giving us a update. Next, John Wagner, Executive Vice President at First 5 LA. Go ahead, John.
Good morning, everyone. And like Debbie, I'd like to thank Sharlene for her great context setting and also the joke. And also Debbie, Dr. Allen for reminding us about the importance of social connections, especially in this time, and for her and the department's partnership on a lot of what we're going to be talking about through the course of this summit. I think that some of my remarks are going to be a little bit repetitive, so in some ways I could just say ditto Dr. Allen, but I do think it's valuable to hear from various partners where there's a lot of alignment and synergy. So I will be highlighting some of that. It's really great to be here with all of you and for the Home Visiting Annual Virtual Summit. And I'd like to acknowledge and thank the many staff across First 5 LA who are here today and support our work in home visitation. Specifically, I'd like to acknowledge the leadership of Diana Cariaga, Director of our Family Supports team, and the entire Family Supports team who every day dedicate their time and talents to ensuring a strong and vibrant home visiting network for LA County's children and families. I also want to acknowledge many others across our organization who do the same. In addition, I want to thank the Family Strengthening Oversight Entity members, Los Angeles Best Babies Network, Maternal and Child Health Access, Work to Live, and PACLAC for their diligent and committed work in supporting the successful implementation of these programs. We are here at the end of a second year of mostly virtual visits, and we've had to settle into a new way of doing things and connecting to families and children, and you've really gotten good at it. First 5 LA continues to be grateful for and applauds your determination and commitment to one another and to the families we serve. This is our third virtual summit, although we do carry hope for an in-person gathering next year if conditions permit. But we are grateful to be able to come together with so many program models across the county, including Welcome Baby, Healthy Families America, Parents as Teachers, and Nurse Family Partnership. As part of my welcome and context setting for the summit, I wanted to say a few brief words about partnership efforts, learning and sustainability, and finally policy efforts for systems change. But first, partnership efforts. We continue, as I mentioned, to work closely with our partners, including the Los Angeles County Department of Public Health, other county departments, LABBN, and the Home Visiting Consortium to demonstrate a collective commitment across Los Angeles County to building a highly integrated, comprehensive, family-centered system of home visiting services. We are getting ready to launch a System Collaborative Leadership Council in the fall, also referred to as a CLC. The CLC will bring together funders, county executive leadership, other key stakeholders, and providers with the goal of ongoing monitoring, adjustment, coordination, and advocacy efforts at a system level for home visiting in the county. The CLC will not only complement existing work of the Home Visiting Consortium, but will help elevate our local challenges and help us advocate for improvements at a system level for areas such as quality, sustainable funding, and other areas so we can strengthen our collective efforts. Second, learning and sustainability. While we know First 5 LA revenue is declining and continues to decline, we continue to actively work to find ways to sustain the system in the long term. Given its significant contribution to the array of supports and services for families with very young children. First 5 LA continues to work with health plans, and we were excited to launch an official partnership with Promise Health this year, with reimbursement for members enrolled in home visiting. We continue to have conversations with other health plans, which we hope will help us continue to sustain the important work you do. We're also excited, as Dr. Ellen mentioned, about the implementation of the Federal Families First Prevention Services Act, or FFPSA. Connected to and led by the Los Angeles County Department of Children and Family Services, we've been able to be at the table early on in the planning process to ensure home visiting is seen as a critical tool in our prevention toolbox. Through early information sharing with county leaders and advocacy at the state level, the FFPSA federally required state prevention plan includes reimbursement for families receiving home visiting supports through HFA, PAT, and NFP. We are working closely with partners at DCFS in the development of a community referral pathway, and data suggests there could be thousands of children who may qualify and help us establish new referral pathways. We also recently concluded a fiscal mapping process, which really was an effort to examine national practice in other jurisdictions regarding how they fund home visiting. And it's provided us with multiple sustainability options at a local and state level. And we're really excited to be pursuing the strategies with the most feasibility for Los Angeles County. This includes exploring how home visitors can be defined as part of the community health worker CHW benefit and be eligible for reimbursement under CalAIM for whole person care approaches, and how home visiting can play a role for families. And finally, policy and systems change. This year's proposed state budget included an increased request of $37.5 million for the California Home Visiting Program funds, acknowledging the important role of home visiting for families. The American Rescue Plan Act will also help us support our system of services locally in the short term. Acknowledging the commitment to home visiting, the First Five Association is also hosting a think tank to bring together expertise from across the state's First Five commissions to help develop policy recommendations for the state. Home visiting is in a critical moment. We know having stable funding is critical to the system, and we know it has been challenging across the network for all models and sites in the past few years. We continue to be committed to being strategic in maintaining the system and infrastructure while these opportunities come to fruition. In closing, we knew creating systems change for a unified home visiting system requires significant coordination and partnership. And we are proud to work alongside the county, DPH, other county entities, and you to better integrate all of our efforts. We look forward to ongoing learning while we continue to meet families' needs, be it in virtual or in person. So congratulations and thank you for your ongoing commitment and amazing work. And I believe I am turning it back to Sharlene.
Thank you so much, John. I really appreciate your words, especially because I think it's so imperative for this network to hear how the funders are working together and accessing different strategies to continue sustaining this work, but also hopefully in the future expanding it as well. So thank you very much to you and to Dr. Allen as well. Next, I'd like to introduce Alina Moran, who is the president of California Hospital. This is a soft spot in my heart because this is where we call home. So Alina, I will pass it on to you. Thank you so much.
Thanks, Sharlene. So first of all, I just wanted to say thank you to everyone. I'm so excited to be here this morning. This is a wonderful event. This is my second event here at the hospital. I started here in March of 2020. And I know this is a wonderful event that brings over 600 staff members, as Sharlene mentioned, over 3 different models, Welcome Baby, Healthy Families America, and Parents as Teachers. I wanted to thank Dr. Allen from the Department of Public Health, John from First Five LA and Department of Public Social Services as funders of this program. But I definitely wanted to acknowledge the staff and the home visitors. They definitely, during this time in the pandemic, didn't really have the opportunity not to work. They had to push forward. They had to continue to do what they needed to do. And they did a great job. They really pivoted their services, moved to kind of virtual home visiting, and now are actually moving to kind of being able to support our families back in the home. And so I wanted to recognize those sites that have already started to doing this and are also preparing to do this. But I think one of the things that I wanted to acknowledge is really because of their tireless efforts and perseverance, we were able to really accomplish two major things. And first of all, we were able to have over 13,000 Welcome Baby hospital enrollments, and over 60,000 home visits were completed across these three models of care. And I think those are extraordinary figures considering how much the pandemic has affected LA County. Lastly, I'm beyond grateful to Sharlene and the entire LA Best Babies Network team for their commitment to this work. And I'm really honored that they are part of the California Hospital Medical Center family team. They are really helping to create stronger families and really helping to continue the work of a hospital, which is really thinking about what can we do outside of the walls of our hospital to create stronger communities and stronger healthcare in the work that we do each and every day. So thank you.
Thank you so much, Alina, and thank you again so much for your ongoing support. We love calling California Hospital our home, so we're grateful for you and the leadership at the hospital. Before I pass it on to Martha for our icebreakers, I have another joke. These jokes seem to just be really big hits, so why not? I'm gonna just throw one out there. All right, are monsters good at math? Are monsters good at math? I already saw Fallon's response, yes, but not unless you count Dracula. All right, Martha, I am going to pass it on to you for the icebreakers. Thank you.
Thanks, Sharlene. Well, good morning, everybody. So good to see you all. And just like there's no meeting without a joke from Sharlene, there's no meeting without a Mentimeter from one of us. So I'm going to pull that up and we are going to see a little engagement from everybody. All right. I expect you all have been in a meeting where we've done a Mentimeter, so hopefully you know the drill here. But in case you don't, to participate, you go to www.menti.com and you'll see the code up on the top, 88 81 86 6, lots of eights, 88 81 86 6. So it will ask you to prompt that code. Put that in and tell me where you're representing. What organization are you coming from today? And if you have not been a part of these before, the more responses that we get that are the same, the larger they will get. So right now we have, looks like a lot of people coming from Shields and a lot of people from the Whole Child. We've got a lot of Welcome Baby representatives. They're moving really fast, so I'm having trouble keeping track of everybody. Let's see, I see St. Francis, I see Miller's, I see Providence Holy Cross, I see Nurse Family Partnership, Spirit, Fig and St. Mary's, Northridge, Valley Pres. This is awesome. So keep going, keep putting those in. And then I'm going to switch to our second question in just another 30 seconds or so. If you look down in the corner here, you can see that we currently have 220, well, 230, 240, it's going up. So lots of people telling us where they're coming from. Well, thank you all. And so happy to have everybody from everywhere with us today. Moving on to our next question. What is the one thing that you are the most proud of from this past fiscal year? You should have a bit longer response. And if you're not able to access the Mentimeter or you feel like putting it in the chat instead, feel free to enter it there. That's acceptable too. And we will be able to read all of those as well. Okay, we have people that are thankful for or most proud of being alive, client participation, resilience, collaboration, staff retention, helping clients virtually, keeping clients engaged, my team, my health, having a job, definitely. Being able to help families with healthcare. The amazing team at White Memorial Welcome Baby. There's a little shout out for you. virtual services, continuing to provide services to families during the pandemic, resilience from the clients. That's awesome. Lots of things to be proud of, definitely. And it's so great to see them all on the screen. I hope that everybody gets pride for the whole network, seeing all of these things that everybody is proud of and proud to share. Thank you, everybody. We are going to come back to this Mentimeter, so you can keep the browser open on your phone or on your computer, however you're doing this. We'll come back to it. Okay. But before we do come back to that, and before we have our keynote speech, we have one more fun surprise. So I am going to share some videos for you.